Hello, I'm Jong Kwon Kim from South Korea. It is my pleasure to present our abstract in ICS 2021. I am going to present a comparative study of a novel, acoustic uroflowmetry-based mobile at voiding diary with a conventional paper-based voiding diary. This research was supported by the Korea Medical Device Development Fund grant, funded by the Korean government. A voiding diary contains important clinical information, including the volume and timing of the void, related subjective symptoms, and fluid intake. However, a conventional paper-based VD has several limitations. In the case of incorrect or peculiar data, a conventional paper-based VD would be difficult and unreliable to interpret. Our previous study introduced a new smartphone-based uroflowmetry device, using acoustic analysis, and reported results comparable to those of contemporary office-based uroflowmetry. The acoustic uroflowmetry system uses a wireless, smartphone-based approach with a recording function to analyze urinary flow. The sound data was recorded in real time with a smartphone application. Several parameters were calculated based on the sounds collected, including voided volume, urinary flow parameters, urinary flow patterns, and time-related parameters. To the best of our knowledge, there are no other portable or mobile-based VDs that automatically record the voided volume. Therefore, we evaluated the usefulness of a novel acoustic UFM-based mobile VD application, which records voided volume automatically by comparing it with a conventional paper-based VD. In the current study, we specifically focused on convenience, satisfaction preference, compliance, and the correlation between the two methods in male lower urinary tract symptom (BPH) patients. A total of 113 patients were included and screened between December 2019 and June 2020. Among them, 35 patients were excluded because they withdrew informed consent, were female, did not complete both VDs, or had no app-supported smartphone. Finally, 78 patients were enrolled, and a subsequent review of all data was performed. The analyzed data was shown here as follows. Number 1. Survey of convenience satisfaction preference comparing the two methods. Number 2. Compliance regarding the completeness of both methods. Number 3. The correlation of each metric between two methods. The completeness results of each method are described here. The acoustic UFM-based mobile VD app showed more completed entries that included one-day full wake-up time and bedtime voids than the conventional paper-based VD, all p-values lower than 0.05. In addition, among 78 patients, more than 85% completed more days on the VD app than the paper-based VD. In contrast, the VD app had fewer total voids recorded. However, the statistical characteristics of both methods were similar. This means that the difference was due to not only the technical differences between the two methods, but the intrinsic deviation of the statistic number of voids and/or voided volume. The survey results of convenience, satisfaction, and preference are depicted in Figure 1. On a scale of 0 to 10, the ratings for all three questions were higher than 8 for the acoustic UFM-based mobile VD application. The rating for the question on the overall preference of the method was as high as 9. A scatter plot demonstrating the correlation between the two methods is shown in Figure 2. A good correlation was observed between the two methods for nocturnal urine volume, 0.55, nocturnal polyuria index, 0.66. The total number of voids, 0.9, number of nocturnal voids, 0.83, and maximal bladder capacity, 0.89, in 24 patients with good concordance. To the best of our knowledge, our acoustic UFM-based mobile VD app was the first portable device recording voided volume automatically. In the current study, we expanded the research on VDs and confirmed the accuracy of the acoustic method. The current novel acoustic UFM-based mobile VD app could also provide longitudinal trends in the urodynamic parameters in a quantitative manner, which will be useful for healthcare providers and payers who need to pre-screen and monitor lower urinary tract symptom (BPH) patients. The possibility that these data may be collected remotely outside the office setting will be valuable as healthcare trends to remote care. In addition, the daily use of the mobile VD app will be valuable in monitoring the patient's response to therapy. This quantitative and ease-of-use app might improve shortcomings of current VDs, such as incomplete VDs with missing values and low compliance. The acoustic UFM-based mobile VD app demonstrated favorable findings in terms of convenience, satisfaction, preference, and compliance. It also showed reliable correlation with a conventional paper-based VD in male lower urinary tract symptom (BPH) patients. Future large-scale prospective studies are needed to further validate our results. Thank you.